Hi everyone, Melissa Wilson, physician assistant and aim at Melanoma's Ask an Expert. Thanks for joining me again for another lecture of Melanoma 101. Today we're going to be talking about what should we look for when we're doing skin exams. And the reason that I say we is because this really is a team effort. So not only should we be doing at-home skin exams, but we should also be seeing a provider, whether it's our primary care physician or our dermatologist or medical oncologist, whoever it is that is in charge of looking at your skin from a medical provider standpoint. This is really a collaborative effort. And I know I check my kids and I check my husband. So this really is a team. So what are the things that we should be looking for when we're looking for abnormal moles? And so I know that a lot of us are probably very familiar with the ABCDE rule. So we're going to go over this really fast. But I drew some pictures. By this point, you know that my drawing skills are a little bit challenged. But when we're looking at what makes a mole abnormal or what makes a mole worrisome that would require biopsy, these are actually the things that we're looking for. And so very simply, A in the ABCDE rule is asymmetry. And so what that means is that the mole can't be folded upon itself. So it's not a perfectly round structure. Instead, it grew sort of haphazardly and one side, doesn't match the other. When you look at borders, which obviously this has irregular borders as well, border is really what does the mole look like around the outside. So some moles will be star-shaped, so they'll come very deeply pigmented in the center and sort of spread out. That's actually abnormal to some degree. You can have what is sort of portrayed in this picture, which is a scalloped border. So moles primarily should be pretty regular and round. And so if they have a jagged edge or a scalloped border or something that looks like it's not perfectly round, obviously that's something that we want to take a closer look at. Another characteristic of moles that makes it atypical is the color. So by and large, the melanocytes produce melanin that should also produce moles that are pretty homogeneous or the same in color throughout the whole mole. Sometimes because of certain disorders that doesn't happen, but anytime that there is not a very regular even pigment in a mole and there are color changes, that is a sign that, some crazy things are happening at a cellular level underneath. So different examples of how it can be pigmented is that you can have some red pigment, you can have darker pigment, and actually you can also have a dropout or a loss of pigment, which is what's represented by this little white spot here. And that's something that's called regression. So any of those sort of changes in a mole, especially if it originally looked, pretty even in color, that's a sign that, underneath the skin and the cellular level that there's something going on. One of the other criteria or characteristics that we look for is diameter. So by and large, as moles get larger, statistically, they also have more melanin and more melanocytes that can cause atypical cells. And so the larger that a mole becomes, the more likely it can sometimes be that there are atypical cells, and that's just from a statistical standpoint. Now, you can also form pigment or moles in skin that didn't previously have moles. And actually, we see oftentimes melanomas form in lily white skin that didn't have a pre-existing mole in it. So that's sort of where evolution comes in, because if there is a new mole where you didn't previously have one before, or if it's getting larger or deeper in color or changing color, or it is ulcerating, which means that it's becoming sort of open and not healing, or even if it becomes pink and itchy, those are all evolution signs that a mole is changing. And the reason that that's important is at a cellular level, your mole should stay pretty stagnant. Obviously, from childhood to adulthood, moles can evolve and change in appearance. And so that's also what makes pediatric melanomas a little bit difficult, because a lot of really scary moles in kids can be completely benign. So as you age and your melanocytes mature, they really should settle down, just like in regular life. We're a little crazy when we're kids, but as we grow up, we should keep our characteristics pretty regular. And so anytime that you see evolution of a mole, whether it's new or changing, that's obviously a sign that there's something deeper going on the inside of the mole. So these are the things that we want to look at, not only when we go to our providers, but also when we're doing things at homes. And so I left you a little note over here before we end that really we should be doing skin exams, and they should start at puberty, because at that point you've genetically made the majority of or all of the moles that you are going to make. So anything that you make after that is either a result of damage to the skin, or perhaps could be a disorder called dysplastic nevus syndrome, which is something we're going to talk about in another lecture. But by and large, by puberty, you should really be getting skin exams, because that's when your moles have fully matured. You can start earlier, especially if you're a kid or you have a child that has really atypical moles. That's going to be important. You should really have at least one professional skin exam a year. Sometimes that increases if you've had a diagnosis of melanoma or you have other disorders that require that. But once a year is really the recommendation. And you should do your own checks at home. You know your skin better than anyone else. And so if there's something that you think is atypical, you should bring that to the attention of your provider. It's super important that we really attack skin checks as a team effort. So I hope that now you know all of the characteristics that we need to look for. You look for the ABCDEs of your skin, and I hope that you'll join me next time for our next lecture on Melanoma 101. We'll see you soon.